All right, welcome everyone to the Thursday edition of Gentle Movement at Home. I'm so glad you could make the time to join us today. We really appreciate it. So today we'll get right into it. I'm Jen Hansen, the Director of Education at Pain BC, and I'm joined today by Neil Pearson, physiotherapist and therapeutic yoga instructor. And Neil has been with us many times. If you have joined us before, you've probably done a class with him. And for those of you that are new, you're in for a treat today because it's always a great class. Just a few notes, a few housekeeping notes, I should say. The first is that Neil isn't able to provide specific medical advice. So we're really happy to answer questions about anything to do with the session, the exercises, but we can't address any specific medical questions. It's really best to talk to your healthcare provider about those things. And there are some clinics that are still open and offering virtual sessions at this time, including GP offices. We're recording this session and we invite you to share it with your friends and family after this, or anyone you think could benefit. The videos are on our Facebook page as well as our YouTube channel. We do ask that you complete a really short poll at the end of the session just to let us know what you thought of the session. And if you do need any technical help, you can just talk to me in the chat or email education@painbc.ca. And we will take a minute at the end just to answer any questions that you might have had about the session. And that's just a really nice time to have a chat with Neil. I always enjoy that. And so if you want to ask a question, put your question in the Q&A, or you can also put it in the chat and I'll read it to him. All right, this is our last session for this week, but next week we've got two because it's a short week due to the long weekend. So May 19th, we're back with Neil. May 21st on the Thursday, again at 1 o'clock with Neil. And then the following Monday, 11 to 12, also with Neil. Looking forward to that. All right, I will stop talking there. Neil, over to you.
Great, thanks, Jen. So welcome to this session. And as with all of these, please remember the idea that this is about both relaxation, but learning new ways to move with ease. So it's a little bit about being curious. Is there a different way that we could approach movement? So that's part of what we're trying to do is give different experiences around how we are breathing while we move, how we're holding our body when we move, and also different movements. So the idea here is not to see how much pain you can tolerate. And the idea is to not only do the things that are completely pain-free. You get to choose where you're going to sort of fall into this. So it's perfectly fine from everything we understand around pain that it's okay to go to the spot where there's just a little bit more pain. But that's not, we don't want to go to a spot that feels like it's completely unsafe. So you will hear me say things like, if it doesn't feel safe, change what you're doing. So if you do feel more pain, what we want you to do is ask yourself, do I feel safe? Do I feel like I'm going to be okay later? And can I keep my breath calm, and can I keep my body calm while I'm doing this? So it's not about going and crashing into the pain. It's if you do get to that spot where you feel your pain increasing, ask yourself, do I feel safe now? Do I think I'll be okay later? And if you're coming up with, it doesn't really feel safe, or I think I'm not going to be okay later, or this is going to stay provoked, then change what you're doing. Pause anytime you want to. You can even pause just to check in. If you're not sure, does it still feel okay? Pause and do that. I'll remind you along the way, but it's important that you know that you certainly don't have to do exactly what I'm doing. So to start, what I'd like you to do is, if you're not in a seated position right now, have a seat and a chair. If you can sit away from the back of the chair, then sit away from the back of the chair. Once you do that, sort of find the right place for your feet on the floor. Find a little bit of length in your spine. So maybe you can let your toes relax and you can feel your big toe mound and your little toe mound on the floor, and maybe your heels, almost like your feet are tripods down there. And you can just push your feet into the floor just a little bit more than resting them. Just engage your legs just a little bit, because sometimes that helps you to be able to get your spine up a little bit taller. If you feel like you're sinking down like this, give it a try to see if you can bring your spine to a taller spot. So you feel like your chest is coming up a little bit, the crown of your head is reaching up towards the sky, but not with all your effort. You don't want to be doing this so you're feeling like there's a lot of tension. You want to find that place where you can do this with a little bit of effort, a little bit of awareness, and you can also, while you're here, keep your breath flowing. So if you found by doing that, you start to hold your breath, see if you can keep it flowing. If you found that when you tried to do this, it's just everything tensed up, so maybe let go a little bit and find that spot where there's some effort, but not too much effort. So once you find that place, remember you can shift anytime you want. You don't have to stay perfectly still. You can move around. So for any reason you want to move, it's not that you only should move when you need to. You can move just because you want to. It's fine. So we're going to try some different things today. We're going to play a little bit. But what I'd like you to do to start is to just check in and see how you're doing right now. Just take a moment and notice what's happening in your body. Scan through your feet and your legs and your pelvis and your spine and your arms, shoulders, neck, head. Notice how you're feeling right now. As you do that, you might notice areas of pain or tension or discomfort. Just check in with them just for a moment to see how they are. If there's something there, you can notice how big it is and how intense it feels, and maybe what the qualities of it has, and then just sort of let that go, but just use that as your baseline. And then if you can, check in and notice what's happening with your breath. It's always hard to do that without changing your breath, but give it a good try. Let your breath just be and notice what it feels like right now. Maybe how long it takes to breathe in and out, whether it feels like it's shaky or whether it feels smooth, what parts of your body are moving while you breathe. So maybe you can feel movements around your belly or your ribs or your chest. Some people even can feel movement of the back of their body as they breathe. The sides sometimes a little bit easier. Or you're just checking in to see how it feels. Then just for a moment, take your attention to your mind. Just notice the thoughts that are there right now. Maybe they're thoughts having to do with what we're about to do, or thoughts that have about what you've done already today, or things you need to do later on. But just notice what's going on. Whatever you notice, just check it out and then let it go and realize that's what I was thinking about right now. And then shift a little bit from thoughts over to emotions and see if there are any emotions there right now. We all know that when we have pain that's persisting, we can feel grief, we can feel sadness, we can feel a sense of depression, isolation. Sometimes there's that sense of anxiety. Whatever's there, just notice what it is. Notice its intensity and its size and what it feels like. And then see if you can just let that go. Because the reason to do this is to check back in later on. And sometimes the best way to check in is to do it really briefly. Just notice it and then go and look for other things. And sometimes it's if you sort of get focused on too much, what you can do is take your attention to something that you're okay with, something that feels all right. So maybe it's paying attention to the sensations in your hand, or maybe there's something out there in front of you that you notice the pain and then you want to take your mind away from it, that you notice something that's in your field of view and you just check that out and try to focus your concentration there. And you can do that during the movements today. If you ever notice that your mind is getting focused on the pain or something besides what we're doing, you can try to bring your attention back to what we're doing, or try to bring it to something that feels like a nice thing to pay attention to. So now next time you breathe in, what I'd like you to do is to draw your knees in towards each other. And as you breathe out, take your knees away from each other. And so you can do a small movement or you can do a big movement. But match up the movement of your knees with your breath. So breathing in, you draw your knees in. Breathing out, you take your knees out. Now I'm going a little bit slowly now, but if you find that your breath is faster, just sync up the movement of your knees to your breath. And even with this, if you want to stop anytime, go ahead and do it. So it's breathe in, knees go in, breathe out, knees go out. And you may be able to see that my feet are sort of rolling out when I do this, and that's fine too. I'm trying to keep my spine tall, trying to keep my breath calm. So as you do this, we're going to get you to add in a different movement, and that's with your arms. So as you breathe in, so next time as you breathe in, you're going to roll your hands out. And then as you breathe out, you're going to roll your palms down or arms in like this. So it's feel a little bit like patting your head and rubbing your belly. And sometimes you have to pause and stop and sort of get the arm movements or get the leg moving and then bring them back together again. But as best as you can, as you breathe in, your knees are going to go in towards each other. Your hands are going to roll out. As you breathe out, your hands roll in, palms down, knees go out like this. If you need to pause and recatch things, do that. If the movement gets really fast, you can slow it down. Now you can stay with this if you're feeling okay with this. If you want to pause and stop, do that. If you'd like a bit more challenge today, what you can do is add in another movement. You're going to add in movement of your neck. So as you breathe in, you're going to turn over towards the right side. As you breathe out, you turn to the other side. So the movement of your neck doesn't have to be big. It's just following along. So breathe in, over towards the right with your neck. Breathe out towards the other side, towards the left. So breathe in, knees come in, hands roll out, head to the right. Breathe out, look towards the left, palms come down or roll in, knees come away from each other. If you have lost what you're doing, come back and start at the beginning. Try just the legs, then add in the arms again, then add in the head again. And try continuing this for just a few more breaths. Now, if it doesn't feel safe to keep on going, pause. If you feel your body getting too tense, if you feel like you start to wonder if you're going to be okay later, go ahead and pause. And at the end of your next exhale, let that go. Sit your back against the back of the chair for just a moment. Feel your feet on the floor again. Let your shoulders relax for a moment. Quick check-in again. What's happening in your breath right now? What's happening in your body right now? What's happening in your thoughts? What's happening in your emotions? And then if you're at the back of the chair, sit forward again. Sit towards the edge of the chair. Let your hands rest down on your thighs and let your spine round. Chin towards your chest, spine rounds. Move the other way. Now this time you can breathe however you want. You can keep on breathing so the movement lasts longer than a breath. Or you could do something like breathe in, come up. Breathe out, come down. So play with one way, play with another way of breath and see how that feels. And if it feels better to do a small movement, if it feels better to do this, go ahead and do this. And if it feels better to do big rounding of the back, shoulders and head up, if that's what feels good today, go ahead and do that. You need to find the right amount for you for today. And know that anytime you feel like that's enough, if you try some big ones and you feel like that's enough, then just pause. And when you're ready, if you feel like a little bit more gently is the way to go, then do that. All right. And just let your spine rest again, let your shoulders relax again. If you feel like there's any tension building up around your forehead or eyebrows or cheeks or jaw or tongue, let that soften a bit. Find that little bit of tall spine again. I'm going to get you to try a bit of a different movement again, a little bit like we did at the beginning. So this time, just start by letting your spine come down the lower back, come into a bit of a slouch, and then have your head just chin up just a bit. Now, the next movement you're going to do is to bring your chin down towards your chest at the same time as you lift up the rest of your spine. So you're going to go back and forth this way. So you're going to be moving your upper back and neck in the opposite direction of your lower back. So that your lower back, when your lower back is coming into a bend, your upper back and neck is coming into a little bit of a backwards bend. When your chin comes through your chest, you're finding a little bit of an arch in your lower back. Remember, it can be small. You can follow your breath. You can slow it down or speed it up, whichever would feel good. So whatever movement of your lower back you're doing the opposite with your neck. I got mixed up there a little bit. Right? So when the lower back slouches, the head is looking forward. When you bring your lower back into more of a back bend, the chin comes to the chest. Remember, you don't have to keep on going. While I keep on going, you can pause anytime you want to. So once you come back to the neutral position next time, just pause there. Again, let your shoulders relax, move anything around that you feel like you want to move around again. This time, what I'm going to ask you to do is to turn and look a little bit over your right shoulder. You don't have to come all the way, just look a little bit towards your right shoulder. And from here, what I'd like you to do is come into the opposite twist. So you're looking over the right, but you're coming into a left twist with the rest of your body. Just try it. Be gentle with this. So instead of moving your neck back and forth this time, you're keeping your neck over towards this position while you move the rest of your spine the opposite way. And then when you finish the next movement, just pause for a moment and do the left rotation, but let your neck go that same direction. So take your head over to the side and your spine over towards the side, come back to the center, whatever amount of movement feels best. Keep on checking in. If you feel like this is safe, feel like you'll be okay later. Remember, you can do small movements or big movements. If you're still moving, come back to the center and pause again for a sec. I'm going to try the other side. So maybe there's something you'll learn by doing that side before you do the other side. Just keep that in mind. So start by just looking over your left shoulder just a little bit. And from here, keep your spine tall and rotate the rest of your spine the other way. And do your best not to turn your head over the right shoulder. So your head stays to the left. Bring your body into that right rotation while your head is still looking over the left side. Whatever amount feels like the best amount of movement to do. Remember, the idea isn't here to see how far you can stretch. The idea isn't to see how much you can tolerate while you're doing this. The idea is to give yourself some movement with ease. It's not going to feel like it's leaving you worse later. So then come back to the center again. If you need to shift something around before you do the whole spine towards that side, go ahead. When you're ready, and don't rush if you're not ready yet. This time when you turn to the right, let your head come to the right as well. Bring your body back. Head come to the right. Body go to the right. Come on back. Great. Only so far as you feel comfortable going. Find the right pace. But for me today, this feels like a nice pace. But I could slow it down and see how that feels. I could pick up the pace, but for some reason today, it just doesn't feel like the right thing to do. Something faster. I'm feeling a need for something a little bit more slow paced today, and maybe that's yourself. But play around with this. The idea is be curious. Try new ways of approaching the same movement. If you're still moving, pause. Sit yourself back to the back of the chair again for a moment. Just stay there. Let your spine be supported. Feel your feet resting on the floor. Your legs are relaxed now. But you can feel the big toe mounds and the little toe mounds of your feet resting on the floor. You can feel your heels resting on the floor, again, like there's a tripod down there. There's a little bit of length in your spine, even though you're supported at the back of the chair. Check in with your breath, and if your breath feels like it's short, make it a bit longer. If it feels like your breath is sort of ragged or catchy at all, see how much you can smooth that out. So with your breath a bit longer and your breath a bit smoother, just start to circle your wrists around. Whatever direction you chose right off the bat, you don't have to do the way I'm doing it. Just move that around a little bit. Keep on checking in, make sure things aren't getting tight. Keep your breath a bit softer, a little bit smoother, a little bit longer. So only move so far as it feels comfortable. And then take the movement to your elbows and take your hands all the way out and up. Whatever movement would feel good here, just back and forth, while you're keeping your breath a little bit longer, a little bit smoother. And let your arms rest down for a moment, and then roll your wrists out, your palms up, roll your wrists down. A little bit like we did at the beginning. This time, if it feels good, just do a little bit more of a stretch to do it. Go ahead. Let your hands rest. Keep on checking with your breath. Make it a bit longer, make it a bit smoother. Take your shoulder blades on up towards your ears, let them come on down, and start to do little circles with your shoulder blades. Don't have to be really big, whatever feels like a good amount of movement. So as you're doing this, do your best to keep the muscles around your face and your neck and your jaw and your shoulders soft. If they feel like they're tensing up, then pause for a moment, move them around a little bit, see if you can let them release. Whatever direction you're going, try the other way. So I was sort of now coming up and pulling back and down and towards the front, whatever would feel good. And then let them pause again. You can still feel your feet on the floor. You can still feel your spine a little bit tall. Let your hands rest down the side if you can. If you have arms in the chair, just let them rest on the other side. If you can, turn the palms of your hands towards the front of your body. And from here, feel your feet on the floor again. Push them down just a little bit. Make a little bit more length in your spine right now. Make your breath a bit longer. Reach with your fingers and your arms just a little bit. And when you breathe in next time, take your arms out to the side like this, and then bring them down as you breathe out. So slow down your breath a bit. And try to do a number of things here. While you're moving your arms, you're coming to that just right amount. If it feels good to take them all the way up, go ahead and take them all the way up. If it doesn't feel like that's the right thing to do, come up to that just right spot. You're going to say, that's enough for now. I'm challenging myself, but not too much. So as you do this, you feel your feet pushing down a bit. You feel your spine lifting up a bit. You feel your breath continuing to flow, doing your best not to hold your breath while you do this. If you feel any muscle tension starting to build, do your best to keep that down. Or pause and shift things around and let it release. If you are still moving, then let that go for now. I'm going to come up into a standing position. You can do the next things we're going to do from seated position, but I'm going to show you, and if you are okay with standing, come on up to standing. If you need the chair for balance, then just have it right beside you for balance if you want. I'll just put it there, just in case I lose my balance. I think I'll be all right, but we'll see. So from a standing position, you can feel your feet pushing down to the floor. See if you can feel that big toe mound and little toe mound and heel, like you have tripods down there on each foot. If your knees feel like they're locked all the way back, then just soften your knees a little bit so you feel like there's a little bit of effort that you need so knees don't release down. So you can feel your feet on the floor and you can feel your knees a little bit soft and you can feel that sensation of trying to lift. Like someone's pulling you from here, but you're doing it internally. You're using the muscles around your spine to lift yourself up a little bit tall. Let your shoulders relax a little bit. If the muscles around your face got tight, try to find some softness there. If you feel the muscles around your jaw are tight, think about it's okay to let go. If your tongue feels like it's tense or it's pushing against the roof of your mouth or your teeth, find some softness in your tongue as well. Maybe you can feel it just release down a bit, or maybe you just reposition it inside your mouth so it doesn't feel like it's pushing anymore. So you can feel your breath and you can feel just the effort in your body of being here. Do the same thing you did while you're sitting there. You turn your palms towards the front of your body and you take your arms out in this sort of plane, not quite back here, not quite here. So lift them on up and then bring them on back down again. Lift them up. Great. Bring them back down. Now, as you lift up, feel your feet. So it's like you're reaching all the way from your feet up to your fingertips if your hands are going up the side. Back down again. Great. And when your arms come back down again next time, just let them relax. Shift them around again if they feel good. If your legs are sort of tight from standing still, move them around a little bit. We should try a little bit of a different movement. So like we did in sitting, where you're moving one part of your body in one direction, another in the other direction. So while you're standing, you could lift your arms up and pull them back and open up your chest and lift your chin up a little bit like this. And let your arms come down and your chin come down. What we're going to do is we're going to do the opposites of that though. So what I'd like you to do is to lift up with your spine, lift your chest up a little bit, pull your shoulder blades like you're trying to come this way. At the same time as you do this, take your arms out, put your fingertips together just out in front of you there. So your spine's up and your arms are there. And then what you're going to do is as you breathe out, You're going to let your lower back move this direction and your arms come to the side. As you breathe in, your spine comes into a little bit of a back bend, your chest comes up a little bit back bend, your hands come to the front. Now, as you do this, I don't know if you can see, but what's happening is I'm getting a little bit of shaky movement as I do this, because this isn't normally how we move. Normally, the way we would move is we would do something like this. So we're trying to get you to focus on moving in a bit of a different way here. So if you've lost that, just pause again for a moment. Feel your feet on the floor. Feel your knees a little bit soft, your spine a little bit long. Lift up your chest just a little bit. Pull your shoulder blades back a little bit, but then take your hands to the front of your body. So it's like your shoulder blades are coming, your shoulder blades are coming back, but your arms are at the front of your body. And as you breathe out, you're going to let your spine round and your arms come back this way. And as you breathe in, your spine comes into a little bit of a back bend and your arms come to the front. As best as you can, keep your breath flowing while you do this movement. If you lose it, just pause, maybe do one movement and then add the other one back in again. And then next time your hands come together, let your arms relax for a moment. Give them a bit of a shake. Reconnect with your feet on the floor again, softness in your knees, length of your spine. And I'm going to go the more usual way while we do this. So next time you breathe in, take your arms out to the side, take your palms back, your shoulder blades back, lift your chin up just a bit, your gaze up just a bit, come into a bit of a back bend, and then round everything forward and then go the other way. So show you from the side. So this is the movement. Go just this place that feels best for you. So rounding everything, breathing in, reaching back, rounding everything. And if it feels good, you can come way back here. But you need to make sure you feel safe while you're doing it. If you're not sure, it's okay to give it a try, but just keep on paying attention. What's happening with your breath? What's happening with your body? Is there any pain? Sort of going to that spot where you can keep that sense of being safe, that sense of being okay later. If you're still doing that movement, just let your shoulders relax. Move your body around again. If it would feel best to sit back down the chair and give your legs a bit of a break, go ahead and do that. Check back in again. Notice how you're doing. What's happening in your breath now? What's happening in your body now? What's happening in your thoughts? What's happening in your emotions? You think you need to change your approach for today? We're going to try something a little bit different now. So I'm going to take a little bit of little imagery with this. What I'd like you to do is to imagine that there's a hammock. And the hammock is starting from just below your belly button on either side. So maybe it's about 12 centimeters across or 6 inches or so across. And the hammock is heading down between your legs and it's coming to two spots or to the end back here. And from that hammock, it's sort of underneath the skin, but there's a rope right here, like a hammock has ropes. And if you were to take those in your hands and you pull them up, what you feel like is like the muscles inside your lower belly at the front and the muscles in the bottom of your pelvis, it's like they're engaging a bit, almost like they're drawing up. So it's like when you pull up these, it's like your pelvis is trying to go that direction, like your back's flattening. But you feel the muscles that do that, and then you let your pelvis go. And when you pull up those, it's a little bit like you can feel the muscles drawing up and to the front, but your pelvis is mostly staying still. So I can't really show you what that looks like. So it's like you do this inside that, it's like that movement would happen, but the movement's not happening. You're just feeling the muscles that would actually engage. So it's like that hammock is being pulled up at the front. So just pause that for a sec. Feel your feet on the floor. Let your knees soften a little bit. Get your spine a little bit tall. Keep on breathing while you're doing this. If it's something new, you'll probably hold your breath a bit. So then take a hold of the ropes of the hammock. And next time when you breathe in, see if you can feel like the muscles inside are drawing up, sort of drawing up between your legs and drawing up underneath the skin at the front of your body. And when you breathe out, you just let them release. It's okay if your pelvis moves while you do this. If it does, then see if you can get that to release. So you just feel the muscles, like it's a subtle thing happening inside. And As with anything we do, if you do this and you feel like that's too much, then pause. Maybe it's something you'll work on imagery, just imagining the feeling rather than doing it for today. And then try the same thing at the back. It's like you have to reach around to the back. You imagine those two ropes. And this time you're imagining lifting them a bit this way. And so the muscles through the buttocks and the muscles through the base of the pelvis are all drawing up and towards the back as you lift up those ropes. And when you do this, you might feel the muscles of your lower back engaging. Because the idea here would be is, could you do this? Next time you breathe in, hold onto the front ropes, draw up like you're drawing up into the front, and then breathe out, release. Then take your hands to the back, pull up the ropes so you feel like the muscles in your lower back and through the bottom of the pelvis are drawing up into the back. And then next time you grab onto the front and you feel like things are coming up and towards the front of the body in terms of the muscles engaging. So it's just a subtle muscle contraction while you do this. I'm hoping you're getting this. If it's hard to do, just keep on working to see if you can find that way. So if you draw up, like the muscles are pulling this way. And if you feel like you can't do it without your body moving, then do that. As you breathe in, you pull up those ropes so that your pelvis come this way a bit. Feel the muscles that do that, then release. Next time you breathe in, you feel like your lower back is coming in a bit of an arch, and you release. And then you draw up the front, and you release, and draw up the back, and release. And then see if you can do it without your pelvis doing that. So you draw up the front, you feel the muscles engage, and then let go. You pull on those ropes at the back, and you feel like the muscles engage inside to pull up, and then release. Now, if it's hard to do that, keep on working on it, or take a break anytime you want. If you're finding it's easy, what you can do is you can play a little bit. And what you can do is imagine, could you take the front right rope and the back left rope and draw up on those? Can you find the muscles inside that would help you with? So you're drawing up these two different sides of the hammock, the front right and the back left. Can you feel those muscles engage and let go? And then the other side, can you feel the left front and the right back? Can you feel those muscles engage and let go? Engage and let go. And can you do it without getting a lot more tension in your body? Now, if you're still working on this, just let it go for a moment. We're going to come back and play with that a little bit and see if we can add some of that in while we're doing some different movements from standing. So let's start with taking your arms back up again. So you're going to take your arms up to the sides and pull your arms back and then lift them back down again. Now, as you do this, create the sensation that as your arms are coming up, the front of the hammock is being pulled up. You can feel those muscles inside getting engaged. And as your arms come back down again, they're releasing. So you feel your feet on the floor, your knees are a bit soft. As your arms come up, it's as if you're drawing up the front ropes. The muscles between your legs and the front of your pelvis are drawing up towards the front as your arms come up to the front. And they're releasing as they come down, back down again. And so you can do it that way. And you can also try it with, as your arms come up, can you pull up both the front ropes and the back ropes at the same time? So it's like the muscles in the front and the muscles on the back are drawing up. Just a gentle pulling up, not using every effort a bit. So as your arms come up, you feel the base of the pelvis lift. You feel the muscles along the front and the back. Try to lift up a little bit as your arms are coming up. Remember, with this, if you're getting stuck, just pause, release the tension, come back to your breath, come back to your body, and then see if you can join back in again. I know it can be a little bit hard the first time, but hopefully you're getting a bit. And also know that, remember, I'm standing, but you can do it here if you're in that seated position. You can still create that sensation like you're drawing up the front and the back as you're lifting your arms up. So I'm going to come back to standing now. If you're still working on that, let that release a little bit. Give your body a bit of a shake, move it around a little bit. This time I'd like you to see if you can pull up all four of those ropes again, the front and the back of the hammock all together, and just hold them just gently. So right now you draw up front and back, and you can feel things drawing up, and you can hold that at just a gentle amount. And come back to just moving your wrists around. While you're moving your wrists around, you still feel your feet on the floor, you still feel your knees soft, you still feel your spine long, but there's that sense of lifting up from all the way down from the pelvis trying to keep your breath smooth. I'm asking you to do a lot of different things today. Give it your best shot. Let your wrists go. Start to move your elbows back and forth just the right amount. But as you're doing this, you still feel your feet on the floor. As you're doing this, you still feel the length of your spine, and you're still trying to draw that hammock up front and back. The hammock's being lifted up from the front of it and the back of it at the same time. This way, gently. You're holding up there while you're moving your arms around. And then do that rolling the arms in and rolling the arms out as best you can, holding that gentle sensation of the muscles engaged, like it's drawing the hammock up. Great. Let your arms relax. Do a little bit of shoulder circle with this and see how you can do with that. You're still drawing up front and back while you're moving your shoulders around. And then go the other way. Great. And then let your shoulders relax, arms relax, move your legs around a little bit. Do your best to feel your feet on the floor again. We're going to try to come into a side bend this time. So we've been playing around with this hammock a little bit. Start with at the beginning, draw the front of the hammock up a bit, draw the back of the hammock up a little bit, put your hands on your hips, and keep drawing up as you come into a side bend. Excuse me. So if you're still moving there, the hammock is being drawn up front and back, and you're coming into a side bend, and you're holding that sensation the whole time you're doing it. Now remember, it's not that you're trying to grip really hard, because if you do that, it's harder to move. We're trying to see if just by engaging those muscles a little bit, by dividing your attention a little bit, if it helps you move with more ease or further. And then try the other side. So you're drawing up front and back. Still feel your feet, you still feel your breath, and you're coming into a gentle side bend. If you would like more side bend, you can take one arm up to the sky, draw up front and back, and come into the side. And if you want to play with this more, what you can do is pause for a moment, release that sensation of the hammock, and maybe try pulling up just the left front and back. And as you pull up the left front and back, see what it feels like to come into a side bend from here. And if it feels okay to try it, just let your arm relax for a moment. Release what's happening around that hammock. Pull up the front right rope, the back right rope. So you're feeling more drawing up on the right side, and try the same thing from there. What happens if you do that and you come into your side bend? Make it easier or harder to breathe? Does it change how far you can bend to the side? Be curious. Do your best to be playful. That arm come down, release everything. Check in again. Is it time to have a seat? Is it time to pause? Or is it okay to carry on? If you're okay with carrying on, put your hands back on your hips again. Draw up all four ropes, front of the hammock, back of the hammock. The whole is gently drawing up. Hold that there while you breathe. Put your hands on your hips. Come into the opposite side bend. Great. Do your best to not tighten too much. Do your best to not hold your breath. So keep your breath flowing. Keep the muscle tension low. If you want to, you can add the arm up towards the sky as you bend to the opposite side. Still drawing up front and back, both sides. If you want to, you can pause. Release. Pull up the front right and the back right. Hands back on your hips or arm to the sky, and see what it's like to do a side bend while you continue to draw up more on the right side than on the left. And then if you want to pause and try the other side, pulling up on the front left and the back left, while you're doing that side bend, go ahead. Again, remember, be curious, do your best to be playful, go to that just right spot. Now you can see how far I'm moving, but maybe you're not going that far, and that's fine. Maybe your hands are on your hips, that's fine. Maybe you're seated in a chair, that's fine. You need to find the right amount for you for today. Because remember, if you try this again tomorrow, it may be a very different experience. Because we all know that pain, it's like a moving target. It changes from day to day and from morning to noon to night. So whatever you're doing now, it may not be exactly the amount of movement you can do tomorrow. And I know sometimes people find that if they're doing something today and tomorrow they can't do it as much, it's discouraging. But it's this idea that often we find that with our movement practice, when we have ongoing pain, the experience is more sort of up and down. And we believe that as we continue, not just we believe, people tell us that as they continue, that the improvements start to sort of get bigger, and the sort of things coming back towards a plateau don't drop down quite so far. One colleague of mine said the recovery around this is a little bit like if you take a Toblerone bar, like out of the package, and put it on a hill. It's sort of that kind of approach is how it is to get better. Sort of a weird metaphor. I'm not sure if it makes it easier to understand or harder. Anyway, if you are still standing, pause, have a seat just for a moment, just check in again, see how you're doing. And I'm going to get you to come back to standing for one final movement in standing. So we're going to do a little bit of a balance. So if you need the chair there or want the chair there for balance, go ahead, have your hand there or hand on a wall. So bring your feet a little bit further apart this time. So they're a little bit like more under your shoulders than closer together, and have them sort of parallel to each other if that feels comfortable. You want to find a stable base to start. So feel your feet down the floor. You can feel that big toe mound, the little toe mound, the heels like to reach tripods, nice and stable. You can feel that softness in your knees, so that your legs are a little bit engaged. You can feel that length of your spine. Put your hands back on your hips again. And the movement we're going to do from here is to shift our weight over. Might as well start with weight over on your right foot and take the sole of your left foot and put it on the inside of your left calf. And hands are here or on the chair. If this feels like it's lifting up too far and your balance is not ready for that today, then when you put your foot up, take the heel of your left foot and put it on the inside of your right shin or ankle. So the toes of the other foot of your left foot are sitting on the floor. So you can be here, or you can be up with your foot against the inside of your calf. If any of you have a regular yoga practice where you bring your leg right up to the inside of your thigh, go right ahead. I'm just not going to talk about that for today. So feet are on the floor, hand on the chair or on your hips. Come back to that idea of ever so gently draw up the front ropes and the back ropes, like you're drawing up that hammock. You can feel it. Muscles between your legs, lower pelvis are engaging just a bit. Muscles in your lower belly at the front engaging just a bit. Muscles through your buttocks and lower back are engaging a little bit, like everything's drawing up just a little. So you shift your weight over as you're holding that up. You still feel your breath, and take your foot up to the just right spot. Keep on drawing up. So sometimes this helps us if we feel like we fall down again. We can draw up inside, front and back, rather than just doing front and just doing back. Try to get it all drawing up. If you would like more challenge today, you can take your hands up to the sky. Doing that, let your shoulders come down. Feel your foot on the floor. Feel your breath. Feel what's happening in your body. If you can, you still got that sensation of drawing up front and back in the hammock. The just right amount, not gripping really hard. So if your arms are still up in the sky, bring them down. If your foot is up against the inside of your other leg, put it back down on the floor. And then release the hammock. Move your body around just a little bit. Release some of that tension. And just pause. Check in. How did that feel to do that on that side? I'm going to get you to do it on the other side. So maybe there's something you learned from doing it on the first side that you can use for the second. So feet again, about shoulder distance apart. Hands are on your hips. Knees are a little bit soft. Spine's tall. Muscles of your face and your jaw and your tongue are relaxed. You draw up the front and the back of the hammock. Shift the weight over onto your left foot. Bring the sole of your right foot either against the inside of your calf or your heel there and your toes on the ground, whichever would feel better for you today. You're still drawing up. If you've got those front ropes are drawing up, the back ropes are drawing up, everything's drawing up just a little bit. And you're breathing. Your hands on the chair if that's what's best for today. If it feels good to take your arms straight up to the sky, then do that. Wherever you get to, breathe there. Smooth out your breath. You can feel your foot on the floor, your knee is a bit soft, you're drawing up front and back, your spine is lifting up. There's a lot to do here. Your arms aren't up, that's fine to have them here. It's fine to have them on the chair. Do what serves you best today. Find that just right amount between effort. So while you're doing balance, anytime you're practicing balancing, you're trying to find the right effort and releasing muscle you don't need, but you also want to be playful with this. For those of you who practice yoga, you may have heard the teacher saying that balanced postures are about concentration, but they're as much about play, because if you're concentrating too hard, then you tend to fall. If your arms are still up, let your arms come down. Put your hand on the chair before you put your foot down, or put your hands back on your hips. Put your foot down, then release the hammock. And you can fully let go of the hammock image now. If you're standing, come on back down to a seated position. Start with your back against the back of the chair. Feel your feet on the floor. Circle your shoulders around just a little bit. Move your arms around just a little bit. If your face or jaw feels tight, maybe move it a bit. Move your hips a bit. Then come back to the edge of the chair. Hands are on your legs. Breathe in, bring your knees in. Breathe out, take your knees out. Breathe in, take your knees in. Breathe out, take your knees out. Sync up this movement to your breath. And then add in the arm movement just like we did at the beginning. So breathing in, knees in, hands roll out. Breathe out, knees out, hands roll down and in. Remember, if you lose the movement, pause, start with your legs, add back in the arms again. If this is feeling okay, and you can add in your next movement as you breathe in. You're going to turn your head to the right. As you breathe out, head goes to the left. Breathe in, head to the right. Breathe out, head to the left. So breathe in, legs in, arms out, head to the right. Breathe out, legs out, arms in, head to the left. When you finish your next exhale, let your hands come down, sit against the back of the chair. Let your breath go. Just like you did at the beginning of the session today, check in. How does your breath feel now? As best as you can, let your breath be. Let it do what it's doing. What's happening in your body now? Notice the sensations of your body. Notice any discomfort or tension or pain. Any other feelings in your body, notice those as well. Check in with your thoughts. What are you thinking about? Check in with your emotions. Just end by noticing what's happening around your heart. Maybe it feels a little bit light. I hope it feels a bit light after that somewhat playful practice. Okay, Jen, I think we'll wrap it up with that for today.
Wonderful. Thank you, Neil. Thank you. Thanks to all of the participants today. That was really well done. Okay, we got 2 questions. And they're about specific, oh, sorry, everyone, if you could just do the poll, that would be brilliant. And then we'll answer the 2 questions, and they're about how you do specific exercises. So we're going to sort of have to guess a little bit at what exercise you were doing. But the first question came in when you were standing up, and it was sort of midway through the practice. And the question is, do you tighten or engage the belly core in the front one? So it was the first time you had kind of stood up and yeah, I don't know. maybe the asker could provide a little bit more context, or I mean, maybe you could answer, Neil, like when you're stood up and you're trying to kind of lift everything up,
right.
are you meant to be engaging the belly at that point?
Yes. So when we either drawing up front and back of the hammock, or when you're pulling up the front, in either of those, there would be that gentle sense of engaging. I mean, the muscle that we talk about is more the transversus abdominis, the muscle that's the deepest of the abdominal muscles. That it's almost the sensation is almost like the 2 sides of your pelvis when you engage it are trying to come closer towards each other. So that sort of core work. The word core is always hard because sometimes we use it when we're talking about big abdominal, like really trying to use the rectus abdominis muscles and the oblique muscles. But here we are trying to get at that more deep one that creates that sensation of drawing in, the sensation of drawing in and lifting inside. So yes.
Yeah, thank you. And then the next question is about the hammock. Which direction is the hammock? Is it across? Like, are you envisioning it across? Or
oh yeah, actually I was thinking that the hammock starts at the front. So this is the front. So if I showed you from this side, that's like one end of the hammock is here. The other end of the hammock is back there. So like if you were laying in it, like say your head would be back here and your feet would be out there. Of course it's shorter because your body's that way, but you're trying to pull this end up this way. So I guess you could think about it as lifting it, from the side to the side. The image I always use is that the front is just the one end. So maybe it's like the front is like the end of the hammock your feet would be at, and the back is like the end of the hammock that your head would be at. But you can switch that around. That doesn't matter.
Okay, I hope that provides some clarity for the next time. Yes, it does.
Yeah, yeah, and this is the first time I've tried to do that without being able to see people's faces. Because
right.
usually when I'm doing it, I can see how if people are giving there's that sort of what the heck are you doing? Then I can to try to find a different way to explain it. So I hope it landed okay on most people.
Yeah, well, I'm really glad that participant asked those questions, because it is hard to know if the concepts are understood, right? If you're explaining them in a clear way. So thanks to you that are asking these questions, because I think it's really helpful for everyone.
Yeah.
All right, brilliant. Well, Neil, we will see you a lot next week.
Right, Tuesday.
And yeah, Tuesday, Wednesday, and then we've got another one the following week. And then actually, I think we've got one on the 22nd too, not with you, but with Helen Turner. So.
Right. Actually, Jen, you just said Tuesday and Wednesday, but we are Tuesday and Thursday next week, right?
Oh, sorry. Tuesday, Thursday. That's right. Tuesday, Thursday next week. Yeah.
Right.
Thank you for that. Yeah. Well, I wish you a terrific long weekend, Neil, and also all the participants. I hope everyone has a relaxing and safe and healthy weekend, and we'll see you next week.
All right. Bye for now.